Good day. It is another great day of learning. So this week 4, we're going to discuss about Module 1 and 2 of our health subject. So we're going to discuss about the consumer health. Consumer health, people aware of the quality of goods that they purchase. Consumer health helps to encourage consumer to be united and raise collective voice against the practice of quackery. It gives the knowledge of the existing law and protection of their consumer rights. So today, the learning competencies of our lesson are explain the guidelines and criteria in the selection and evaluation of health information and products and services. And number 2, discuss the various forms of health service providers and healthcare plans. All of us are consumers. We acquire health information, purchase health products, and avail of health services to appraise, improve, and maintain our health. Health information is any idea that we hear from people around us, read from books and other printed materials, or from the media that influence our health. In line with this, we must educate consumers who make wise selection of information, products, and services that are scientifically proven and legally approved. It is our duty to evaluate and examine the reliability of the sources. So what is consumer health? It refers to the decisions you make about the purchase of the product and use of information in health information and services that will have direct effect in your health. And who are the consumers? So consumers means natural person who is purchaser, lessee, recipient, or recipient of consumer products, services, or credit. And there are different kinds of consumers. We have the spendthrift, close-fisted, wasteful, bargain addict, intelligent, impulsive buyer, and panic buyer. So let's distinguish these kinds of consumer. First, spendthrift consumer. You lavish yourself with anything or everything that is something luxury. Thrift or economy is not their vocabulary. They are kind of consumer that they buy anything that they want. Next, intelligent consumer. You prioritize your need rather than wants. Limit the purchase on your ability to pay. The intelligent consumer is the one who buy what is your need rather than wants. He spend most of the needs or the goods that he consume on what is needed. Next, the bargain addict. So you have an obsession for all the types of bargain and sale and becomes an easy way or easy prey to the sale traps laid by deceitful traders. So the bargain addict is the one who consumes or have the habit of buying in large quantities based on the rumor. If somebody says that tomorrow or petrol or sugar will not be available, they will buy in large quantities and hoard them. At the same time, they are the one who prioritize the word sale. Next, the close-fisted consumer. So the close-fisted consumer are someone who hoards money, but you deprive yourself of your needs. So this type of consumer is the one that they do not want to spend money even for buying foods. So they tend to become hoarders and the word thrift or pagtitipid is in their vocabulary. Next, panic buyer. So the panic buyer, you are easily agitated by rumors of rising prices, product shortages, and political disorders and tend to hoard unreasonable quantity of household supplies and thereby contributes to price increase and artificial shortages. Panic buyers or the panic buying is the action of buying large quantities of a particular product or commodity due to sudden fears of a forthcoming shortages or price increase. Next, impulsive buyer. Impulsive buyer, you do not prioritize your need. You buy anything that you think you need or like to regret it afterwards. So they are the type of consumers or in the field of consumer behavior, an impulsive purchase or impulsive buying is an unplanned decision by a consumer to buy a product or service made just before a purchase. They are the one who tends to make such purchases is referred to as an impulsive purchaser, impulsive buyer, or compulsive buyer. And next is the wasteful consumer. You have the habit of leaving the lights on, ignoring leaking faucets, buying more than enough food that you can consume, and throwing away good food away. So there are different kinds of consumers' rights and responsibilities. And being good consumer means knowing what to look out for and what to avoid. It means to know where and how to get the best value for money, where to go if things go wrong. Your role as a consumer has both right and responsibilities. First, the right to safety, to be protected against products, production, processes, and services that are hazardous to health or life. Second, the right to be informed, to be given facts needed to make an informed choice and protected against dishonest or misleading advertising and labeling. And third, the right to choose, to be able to select from a range of products and services and competitive prices with an assurance or satisfactory quality. So let me show you a video about the consumer rights and responsibilities. So now let's discuss about the three components of consumer health. We have the health information, health products, and health services. Let's discuss about the health information. It plays a big role in the life of an individual. It is information that people require to make wise choices and decisions about their health or the health of other people. While the health products, these are the food, drugs, cosmetics, devices, biologicals, vaccines, in vitro diagnostic reagents, and household or urban hazardous substances, and or a combination of and derivative thereof. So these products may be purchased from various places like supermarkets, pharmacies, and hospitals. And next, we have the health services. So this component was often connected to healthcare, and these programs aim to appraise the health conditions of individuals through screening and examinations, cure and treat disorders, prevent and control the spread of diseases, provide safety, emergency care, and first aid, and ensure a follow-up program for individuals who have undergone treatments. So in our module 2, we are going to discuss about the different healthcare professionals and the fraudulent services like the alternative medicine or the naturopathy. So in this module, you are expected to number 1, select health professionals, specialists, and healthcare services wisely. And number 2, know how to report fraudulent health services. So health services are usually offered by healthcare providers. So they are the healthcare professionals or health professionals. A healthcare provider is a trained professional who provides people with healthcare. So there are different types of healthcare providers. So such as the health professionals. So these are the individuals who are licensed to practice medicine and other allied health programs. So first we have the cardiologist. These are the doctor who specializes in the study or treatment of heart diseases and heart abnormalities. Next, dermatologist, a medical practitioner qualified to diagnose and treat skin disorders. Next, gastroenterologist, a medical practitioner qualified to diagnose and treat disorders of the stomach and intestines. Next, gynecologist. So a physician or a surgeon qualified to practice in gynecology or gynecology. So the gynecology is a science of the treatment of diseases of the female, sexual organs, and reproductive tract. Next, neurologist. These are specialists in the anatomy, the functions, and organic disorders of nerves and the nervous system. Next, orthopedist. The orthopedist definition is a specialist in orthopedics. A doctor is specialized in the branch of medicine concerned with the correction or prevention of deformities, disorders, or injuries of the skeleton and associated structures. Next, ophthalmologist, a specialist in the ophthalmology. The credential include a degree in medicine followed by additional 4 to 5 years of ophthalmology residency training. Ophthalmology residency training programs may require a 1-year pre-residency training in the internal medicine, pediatrics, or general surgery. So the ophthalmology is a science that take treatment on eye diseases. Next, pediatrician, a medical practitioner specializing in children and their diseases. Pulmonologist. Pulmonology is an area of medicine that focuses on the health of the respiratory system. Pulmonologists treat everything from asthma to tuberculosis. Next, urologist. Urology is the field of medicine that focuses on diseases of the urinary tract and the male reproductive tract. Some urologists treat general diseases of the urinary tract. So now let's discuss about the different healthcare facilities. First, we have the hospitals. It is an institution where people undergo medical diagnosis, care, and treatment. There are different kinds of hospitals. We have the private, the voluntary, the government, and the teaching. So the private hospital is the one operated by individuals to gain profit, while the voluntary hospital does not require profit because it is owned by a community or an organization. Next, the government or the public hospital. It was being run by the state and the treatment fees are subsidies. And the teaching hospital includes a school for medical students. Another healthcare facility is the walk-in surgery center. It is a facility that offers surgery without the patient being admitted in the hospital. Next, health center. The services in a health center cater to a specific population with various health needs. And next, extended healthcare facility. It is a facility that provides treatment, nursing care, and residential services to patients, often the elderly. So if we do have the healthcare facilities and healthcare professionals, might as well we should have health insurance. So it is a financial agreement between an insurance company and individual or group for the payment of healthcare costs. Example of health insurance is the PhilHealth. Health insurance may be sourced from both public and private companies. An example of public health insurance is the PhilHealth. As mandated by the law in the country, employees of both public and private companies avail of PhilHealth. It requires a small monthly contribution from its members. These contributions are saved from medical care needed by the PhilHealth member. Consumers receive health information, products, and services from various sources, thus individuals may be prone to frauds. And an example of this is the quackery. So quackery is a form of health fraud. It is an advertisement, sale, or promotion of products and services that have not been scientifically proven safe and effective. It is being operated by a quack or a quack doctor. So a quack is an individual with little or no professional qualifications to practice medicine. He or she also pretentiously uses meaningless medical jargon and relies on discard tactics, paranoid accusations, and quick fixes. In the country or in our country, Republic Act Number 8423, or the Traditional and the Alternative Medicine Healthcare, which works closely to the Department of Education, which this is a lawmaking body with regards to the effective use of the traditional and alternative medicine. So one alternative or the traditional medicine is the naturopathy. It offers a wide range of natural practices including herbal medicine, acupuncture, acupressure, nutritional therapy, and the ventosa cupping massage. So when working in collaboration with the traditional treatment or the alternative medicine as prescribed by your doctor or in physical therapy team, some complementary medical techniques can speed your recovery and make it more comfortable, like in your whole body, your personal attention, the natural and healthy approach, and it is less expensive. So as you can see on your screen, these are the different lists of the herbal medicine. So we have the Acapulco for ringworm and other skin infections, Ampalaya for non-insulin dependent diabetic patients, Bawang for blood pressure control, Bayabas for use as antiseptic to disinfect wounds, for mouthwash or tooth decay and gum infection, Lagundi for cough and asthma, Niyog-niyogan for intestinal worms, particularly ascaris and trichina or the parasite, Saang gubat for mouthwash, Sambong for urinary stones, Pansit-pansitan for arthritis and gout, and Yerba Buena for relief from body aches and pains. So aside from the herbal medicine, we have the alternative medicine. First, we have the acupuncture. It is a form of energy medicine where long, thin needles are inserted to specific parts of the body to affect the energy flow. It is believed to treat musculoskeletal dysfunctions. Next, the ventosa cupping massage therapy. This procedure is done by placing inverted glasses that have flames from burning cotton at specific points in the body. It is believed to relieve muscle and joint pain. Next, reflexology. Similar to acupuncture, reflexology focuses on treating specific disorders through massaging of the soles of the feet. Next, acupressure uses the same technique as that of acupuncture. The only difference is the acupressure does not use needle but hands to apply pressure on the certain points of the body. And next, the nutrition therapy. Nutrition therapy approaches treatment of a medical condition by providing a tailored diet for the patients. Muli, balikan natin ang inyong weekly home learning plan para alam nyo ang gagawin nyo sa linggong ito. Una, sagutan ng What's In Activity 1, may source of information sa pahina 4 sa isang intermediate paper. Sunod na araw, Martes, pag-aralan ng Lesson 1, Components of Consumer Health. Basahin ng What Is It sa pahina 5 hanggang 10. Wednesday, pag-aralan ng Module 2, Healthcare Providers and Fraudulent Services. Basahin ng What's In sa pahina 4. Sagutan ng What's New Activity, The Magic Bracelet sa pahina 5 hanggang 6, isang intermediate paper. At kung tapos na kayo, sagutan ng Assessment 1 hanggang Assessment 1, pahina 9 hanggang 10. Balikang muli ang mga lessons at activity worksheets sa health, suriin ang lahat kung nagawa at natapos. At huwag kalimutang gawin ang reflection sa sagutang papel. Ano ang pinakamahalagang natutunan mo sa lesson na to? Sino ang katuwang mo sa pagsasagot ng module? At higit sa lahat, huwag kalimutang lagyan ng pangalan at lagda ng inyong magulang ang box na nakikita ninyo o kahit papermahan nyo sa magulang ang bawat pahina ng inyong intermediate paper. At muli, Happy Module Day!